Hi, I'm Deborah. Welcome to my channel. Welcome to my kitchen. Today we're going to look at, are we going to have a second wave? If we do have a second wave, what should we do to protect ourselves, to protect our family, to stay safe? How bad is it going to be? Well, I'm going to give you the answers to those questions, so click the subscribe button and let's get started with 12 tips from experts and government medical officials on how we should be ready for the second wave. Experts say we are going to have a second wave. How bad it's going to be, that's the question nobody's really sure about, but for sure the numbers are going to rise as we get into fall, winter in the northern hemisphere, which is also cold season and flu season, where people just generally get more respiratory and more viral illnesses anyway. The second wave has actually started in some countries. In Asia, it started in the summer, and in Europe, it's starting now. In Canada, we're starting to see our numbers go up, and in parts of the Middle East as well, they're starting to see an increase in cases. So it's looking like the second wave is starting, just as experts predicted. Just the fact that we are getting out and about more after lockdown means that the experts say it's very likely that a second wave will happen. The big question that nobody has the answer to is it going to be boom? Is it going to be boom? Is it going to be low, not too bad? Is it going to go crazy again? That's what we don't know. So tip number one, get all of your kind of regularly scheduled appointments out of the way as much as possible. So for example, go for a haircut. I didn't have a haircut for 7 months. I got it done a week ago, and now I'm good for another 7 months. Any dental or medical appointments that you need to have that are not for emergencies, that are just regularly scheduled appointments, try to get those out of the way as possible. So as many appointments as possible, eye doctor, whatever it is, optician, that you would do on a scheduled basis, not because of an emergency, try to get them done as soon as possible. That's tip number one. Tip number two, stock up on non-perishable foods. The Canadian government recommends that you have a month's supply of food so that whatever happens, you don't have to make emergency trips out to the grocery store. And especially if you're sick, you're not even allowed to leave your house. So that way you're prepared. You have whatever food you're going to need for a month. Stock up on any essential medicines, so maybe painkillers, cold medicines, but also any prescription medicines. Try to have a month's supply of that in your home. Tip number four, try to have a 1 month supply of face masks, of the sanitizing wipes if you use them, of hand sanitizer. Sanitizing wipes, if you look at one of my earlier videos, it will tell you how to make your own sanitizing wipes, which is common household products. So you could look at that. Tip number six, try to stock up on also essential products like bleach, like isopropyl alcohol and hydrogen peroxide. And if you have any machines that require distilled water, it's good to have, a month's supply of that as well. So try to have enough of a supply to last for at least a month or two of those. Tip number five, get a flu shot when it becomes available. It's a good idea, and if it's possible in your area to get a flu shot, it's a good idea. It will help protect you against at least one of the viruses that we know comes around every winter. And if you are eligible or prone to get pneumonia, get a pneumonia vaccination if you can in your area. A few winters ago, I had pneumonia 2 winters in a row, and even though I was too young to get the pneumonia vaccine free of charge, I still decided it's worth it for me to pay to have it. And I have not had pneumonia since then. If you have a tendency towards respiratory illnesses or pneumonia and you haven't yet had a pneumonia vaccine, look into it, consider it, and if you can, get it done. Continue the same behavior recommendations that we've been having since the beginning of the pandemic. Social or physical distancing, minimum 2 meters, wearing a mask when you're indoors, not shaking hands, not hugging, not kissing, to greet people that do not live in your bubble, just following all the recommendations of the governments and the medical experts in your area, because these will help prevent the spread of the virus. Follow the frequent hand washing recommendations, especially if you've been out of the house. Stay home when you're sick, even if it's just a cold. You may not get very sick with a cold, but you may pass the germs to someone who gets horribly ill with a cold, like me. I just get a regular cold and I'm in bed for 4 days. You don't want to be spreading germs or wherever you may go. Stay informed of all the requirements and recommendations for your area. Tune into the news media and stay up to date with any changes in requirements. And finally, so just mentally prepare yourself for the fact that it is going to be a little harder and we will not be able to do everything we want to do, and maybe not have family gatherings like we were, and maybe Christmas is going to be a distance Christmas over Zoom or who knows what. But the pandemic will not last forever. It will end. This will end. We just don't know when. So take it day by day. Stay positive and just remind yourself, fall and winter don't last forever. The pandemic doesn't last forever. We will get through this together. Find the support systems that you need to keep yourself positive. If you're struggling with that, get help. These recommendations, these tips, they all come from government experts. This is what they're really saying, we have to keep following all the rules in order not to go into another lockdown. But I know in our area, if the numbers start to go crazy, the government's putting us in lockdown. I know that. It will happen. So if we don't follow all these recommendations and try to keep the numbers of the virus not too high, lots of parts of the world are going to go back into lockdown. So let's help each other. Let's do this together. We've only got 4, 5, 6 months of fall and winter and then into spring, depending where you live, but we can do it. I hope you found this information helpful. Click the like button and subscribe to my channel. I talk about all kinds of things relating to food and kitchen and ideas and how to save money on your grocery bill and how to cut waste. And this video is a part of a series of videos I'm doing on COVID and your home. So look at the other videos if you haven't seen them already. And I look forward to seeing you next week. So stay safe, stay well. Thanks for watching.